for being able to function in the new world. The new world defined by these payment mechanisms as well as patient responsibilities and accountability. I'll tell you, this slide is true. Everything about this slide is absolutely true. There's one thing, though, that bothers me. An EMR is really only good for inside the walls. What we have now from Epic or Cerner or anybody else, you can name them. Do you have it here? Do you have any? Meditech. It's good for inside the walls. It doesn't relate to a patient. It doesn't relate outside. It doesn't relate to home health agencies. It doesn't relate to physician offices. It can, but it's not designed for it. And it needs to be, because that's where the whole thing is getting ready to go. I expect you'll have to spend a whole lot more money to adapt to whatever system you've got. So plan on more expenses. In this particular geographic locale, you've got a challenge. And that challenge is the oil companies sucking away your employees. Everywhere in South Texas, people are leaving to work for the oil companies. It means also that these kinds of things are going to drive you crazy from a management perspective. HR is a big deal. Without a properly run human resources department or job descriptions or pay or benefits or whatever it is you need, you cannot implement effective strategy. So this is going to be a key strategy going forward. Across the country, a lot of staff reductions. It's a problem. It's also a success. Methodist Hospital, right in San Antonio, $300 million bottom line, just those 5 hospitals last year. 5 hospitals. Bottom line success, $300 million. HCA took 150. Methodist Health Foundation, or whatever they call themselves, took another 150. The way they did that, a lot of staff reductions. And there are some concerned docs, I've talked to a lot of them, who said they're barely holding it together. They're barely holding it together. So that's the balance between having one foot in today and reducing costs to maximize bottom line, and one foot preparing for tomorrow, which is costly. IT cost, redesign cost, understanding what's going to happen and preparing for that. This is something you got to watch. Provider consolidation. The hospital, growth of health systems, medical groups, IPAs, the United experience in Arizona is one with a hospital. They also bought the largest medical group in the state of Nevada and the largest IPA in the state of California. Again, for the same reasons. Trying to understand the way physicians work. And 2,500 physicians at IPA in California and 54 medical group in Las Vegas. So that's a very important understanding of where things are getting ready to go. Carl told me today as I walked in that the Vanguard Hospital built in the city base is closing OB. Why were they? Well, they're full of other patients that make more money. And so OB's shut down. So you're going to see some more consolidation. Within health systems, you're going to see more and more emphasis on this hospital is going to take care of cardiovascular. This hospital is going to take care of orthopedics. And so the physicians will concentrate, the nurses will concentrate. In fact, it's probably good for the patients. It may not be good for everybody else who has to be kind of in one place or another, particularly if you have a multi-specialty orientation. Or if you're an anesthesiologist, you may have to run around a little bit. You already do that. It's interesting, in California you don't, because they have the anesthesiology groups run the ORs. And so they stay put, and the other doctors come. But in Texas, the anesthesia guys run around. Hospital deals are going forward. Employers will drive change. In other news, today's paper, Wilson County's growing with jobs. Inner city San Antonio, inside loop San Antonio, not growing. New Braunfels is growing. Outside edges are growing. Wilson County is poised for more growth. So your employers here may begin to make changes in the way they react to you. My wife is a professor at the University of Incarnate Word. She's not a tenured faculty, so she gets paid by the course. They announced in her department just last month, you can only teach 2 courses. Cannot teach 4. Anybody know why? Any more than that? She's a full-time employee at the University of Incarnate Word, has to cover her benefits. So, will employers send employees to exchanges? In the case of University of Incarnate Word, the answer is yes. So that's probably going to happen more and more. That may not be bad because they're going to get insurance and coverage and all that sort of thing. But it's a matter of change. It's a matter of understanding what's going on. So this is a summary slide to say where were we and where are we going. The key is really the bottom line. Maintaining health is going to keep people out of the doctor's office, out of the hospital. That's not good for us as providers. I made a living on people who were sick. We built hospitals, we provided services, we did all the stuff we had to do because people had disease. Now, is that going to happen? Probably not. How many of you have ever been to a dentist and the dentist says, brush and floss? Nobody else? Every time I go see my dentist, that's all he says. Prevent tooth decay. Are dentists successful? Yeah. Because our population has issues with health and other things. We're going to go through some of those as we go through this next piece here. So in the near term, case rates will be affected in September. Got some changes in programmatic pieces, dual eligibles, and Medicaid. It's going to be a big deal in the state of Texas if Medicaid goes. I know in the state of Arkansas, you know what happened in Arkansas this week? The Arkansas State Legislature passed a bill which the governor has said he will sign, which takes the money from the federal government for this 3-year period, you know, the increase in Medicaid payments to incentivize, and they're going to take that money and buy an insurance policy and give it to Medicaid eligibles. So there's lots of different ways of looking at things. That's done in Germany right now. So it's not that it's bad. It's just a different way of looking at things. And so you got near-term changes also in 2014. So the key for us is we've always followed the money. Primarily, beforehand, we followed the right road. Now, the money is telling us we got to follow the left-hand road. There's a fork in the road. But in fact, it's really the same thing. Quality, improved quality does in fact reduce cost. You take care of somebody better. I mean, I don't know what you do for your living, but if I take care of my car, I spend less money repairing my car. Patient access and satisfaction. We've been trying to help patients access us for eons. Well, we have to figure it out better. And large primary care physician networks, that was a challenge, particularly as many primary care physicians stopped using the hospital. They referred to hospitalists. They just didn't come to hospitals anymore. Like 90% of all admissions now are from hospitals. But the key here is, this is where we're going. Coordinated care, patient value, and that's what the whole thing's all about. Okay, take another note. Clinical integration. It's important. It's real important. It means different things between clinicians and patients. But it's real important for going forward, and it will take a long time to get there unless you're willing and you're open to new structures. But basically what we're talking about here is everybody's talking to everybody else. You know, when Popovich starts yelling at his team because they failed in some scheme, either offensively or defensively, what he's usually saying is, you're not talking to one another. Everybody knows what to do, but of those 5 players that he has out there, they can't all be trying to win the game. Next time you watch a game, watch Nando Di Colo, and within 5 seconds of getting the ball, he'll shoot. That's why he's on the bench. He doesn't pass. It's called coordination. It's called communication. And that's what we're going to have to have. So within a clinically integrated, high-performing organization, now you'll see a bias. I think this is a very important aspect to go forward. These are the 5 things you're going to have. Very good physician leadership, a coordinated delivery network, excellent IT, understand what care management is all about. I showed you the pyramid, and then understanding your contracts. And I'm going to go through each of these very quickly because I don't want to underscore it too much. But the key is physicians must be at the table. They just have to. And I'm not saying one physician, not one physician representing all other physicians, which a lot of hospitals used to do. Well, the chief of medical staff, he represents the whole medical staff, so we'll bring him into the board. That's not what I'm talking about. I'm talking about good understanding between the med exec and between the hospital board and, in fact, every day coordination. When I was administrator and administrator at MD Anderson, every day was grand rounds. Every day, all doctors got together with the administrator and with nursing to discuss every single patient. Good patient care. What resulted? One word here. Write it down. Segments. The little symbol at the bottom. Those are the kind of segments it's going to go into, and you can add any segment in there you want. But I'm going to suggest to you that increasing your ability to function in different segments that are related to patients is a key high-performing indicator. IT, got to have it. Care management capabilities. What's this all about? It's about talking to each other. This patient had this, handoff, we don't need this. Is the IT working to make sure the information flow is good? This is what it's all about. If we're in the business of providing health care, we have to provide it from a team concept. That's what the bottom line is really all about.
Would you mind going back one slide for just a moment? The one with the sections you had in there, segments right there. Hospital physicians. Okay, thank you.
That's just a sample.
Yes.
I mean, you could multiply this times 5 if you want to.
Thank you.
Okay. So key here is figure out a model of relating that is going to improve your organization. And then understand your contracts. You got to understand financial risk. We've been in the capitation world before. A lot of people failed. It may be coming back. I happen to think not in 10 years, but in 20, we will be at a universal health delivery system in the United States.
You mean a single payer system?
Something like that. Yeah. Now, the insurance companies may object, but I think that's the direction we're going.
They may object. They will object.
Yeah. And they may figure, because of the way we are in our pluralistic society, we may figure out a way that they can be part of it, and that all of them will have to merge together, and then we'll all be part of one big
happy family.
One big happy family. Well, you may not be happy with it, but I mean, sometimes there's a river that's flowing, and you may not. It may be so muddy you don't want to get in it, but it's going to flow whether you're in it or not. And that's what I'm telling you is this thing is so big that it's beyond any one person's ability to stop it.
After 3.5 years, could this thing just be turned on in?
Not with a Supreme Court decision. That was the key. I about fell out of my chair when the chief is the one who wrote the opinion.
What if it's an abject failure 5 years now?
Well, I mean, I can tell you that I think that it will be tweaked, just like everything's been tweaked for the last 50 years.
The post office is losing $8 billion a year, but it's still working fundamentally the same as it always has.
I think the
government doesn't change.
Is that what the system we have is an abject failure for everybody except us. We're doing great. Fee for service is a wonderful thing for physicians. It's an okay thing for hospitals. But the truth is, 17% of our GDP is going to healthcare. If we keep doing this, it's going to be 25% before we turn around. And our healthcare is going to kill our economy. So it doesn't matter what actually happens with administration. Something's going to change. This is unsustainable. And so we've got to figure out how to help it change.
What brought down the big players in Detroit? It wasn't a recession. Their fate was sealed before we had this recession because they could not afford health care costs for current and past employees. It was too much money. That's why they all got together. They gave the unions a set amount of money, said, okay, from now on, this is your baby. We can't manufacture a profitable, competitive product when we've got these kind of health care costs on our back. The acceleration in healthcare costs has been the single largest component of flatlining middle class income in this country for the last 20, 30 years. Increased premiums, increased co-pays, reduced coverage. It's a fact. It's ruining our economy. And if this acceleration in healthcare costs keeps going, we won't have even the 50th best healthcare delivery because we'll have so many people left out. There are 8 million uninsured people in Texas alone. We have more uninsured people than anybody in the country. And we got a governor who says we're not going to expand Medicaid to cover these people when the federal government's going to pay 100% of it for the first 3 years and 90% thereafter. That's crazy.
I mean, I think there's a lot of, not to delve into politics, but there's a lot of reasons why Texas has a very high uninsured population.
Well, there are a lot of reasons, but it's...
And I think a lot of what's driving the healthcare costs in this state is not so much physician care, it's pharmaceuticals, it's
Exactly.
Oh, sure.
devices.
Oh, it's everything.
There's a lot of people making a lot of
that's
money
it.
outside of medicine
Yeah.
that have nothing to do with the physicians, the nurses,
You're exactly right.
and the
But-
techs in the operating room.
But-
But I feel like under this plan, we're the ones we're the ones taking the punch in the gut, the cost.
Not if we integrate care, not if we come together to save costs and have an opportunity to share in those cost savings. Right now, this system, it encourages overutilization of services. There's no way getting around that. You can argue till the cows come home. What Dr. Fry and I get on a per patient basis adjusted for inflation is less than it was 20 years ago. And so what are you going to do to maintain a standard of living that somebody who's gone to these schools and takes the kind of responsibility that we take? You increase the number of patients you see. I get patients who come to me and say, I've been having to go to my doctor every 3 months. I don't understand why. Well, I understand why. It's bottom line medicine. And until we get medicine out of the bottom line business model that Wall Street adopted a long time ago, we're going to have this same problem. So what Mr. Maddox is talking about is integrating systems and getting people together to figure out ways to save money and improve outcomes. Because in this rush to see more patients, to do more procedures, to have more specialists, the outcome part of the equation has been left out. We don't have good outcomes in this country. If you're rich, you got a good job, and you got insurance, maybe you'll have good outcomes. But there's 30 or 40 million people who aren't in that boat. And there's a lot of those people who are hardworking people. They're not the 47% who consider themselves to be victims, who don't have good coverage, and they get their primary care in the emergency room because they can't afford to go to the doctor.
I don't think the doctors will necessarily have to take a huge hit, but I think that we will take somewhat of a haircut for sure. But I think that we need to be vocal about the exorbitant profits that Medtronic, for example, makes. They make a machine, costs about $7,000 to make it. They sell it for $49,000. If you haven't seen the Time magazine issue that was called The Bitter Pill, that is probably the best single source of a description for the ill that is in our system. And the doctors are a very small part of the illness, I think. It's and insurance companies are one of the more profitable enterprises in this country. Their profits have gone up, our premiums have gone up. I mean, they've gone up horrifically. So we have to. And what happened? We gave the power away 25 years ago.
Well, and